Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Cosmetic procedures can be a wonderful form of self-care for many people, but women often wonder, are these procedures safe during pregnancy and breastfeeding? Today is part one of our series where we'll be giving you the scoop on some of the most common cosmetic procedures and whether they are safe for you during pregnancy and breastfeeding. So click those like and subscribe buttons and stay with us. Hair removal is a very popular cosmetic procedure. Let's start with laser hair removal and electrolysis. There's no safety data about whether these are safe during pregnancy, so they probably should be avoided. Electrolysis, if used in the last trimester, should definitely avoid the breasts and abdomen. There are two types of electrolysis. Galvanic is not safe during pregnancy because this uses electricity, and electricity can travel through the amniotic fluid directly to your baby. The second type is thermal, and thermal is okay during pregnancy, but all of these laser hair removal and electrolysis methods do run one risk. The hormones during your pregnancy make you prone to sunburn and hyperpigmentation, so the electrolysis can cause some discoloration of your skin. Furthermore, your pregnancy hormones may reduce its effectiveness. Waxing is another form of hair removal, and this should be safe, but understand during pregnancy your skin becomes more sensitive, so waxing may actually hurt more. Then we have the creams, which contain chemicals that are absorbed through your skin. It is not recommended to use these creams because we are not aware about whether they can travel through the placenta or into your breast milk. Finally, we have shaving, and while this is the most tedious, this is considered the safest hair removal system. No matter what, make sure you talk to your healthcare provider before using any of these methods to ensure their safetiness for breastfeeding and pregnancy. Tanning is another common form of cosmetic procedures that women enjoy. You should avoid tanning beds and natural UV exposure like sunlight while you're pregnant. Both of these can interfere with your folic acid deficiency and may lead to birth defects. Tanning beds will also raise your body temperature. This has also been associated with spinal birth defects. While you're pregnant, the hormones that you are experiencing may lead to chloasma, which are dark spots on your face, and tanning beds and UV exposure can exacerbate this. Spray tan is also commonly used, but it contains a chemical DHA, which can penetrate the skin and is contraindicated during both pregnancy and breastfeeding. There are also available in some countries tanning pills, but these are illegal in the US and they are absolutely contraindicated. You can go sun tanning if you are breastfeeding. That is considered safe. It's also possible that you can use self-tanning lotion, but it's unclear. However, you need to stay away from any products, again, that contain DHA. Finally, if you go to use a tanning bed and are offered a keratin upgrade, you cannot use this while you are breastfeeding. Keratin is vitamin A, and this is absorbed into your breast milk, and you can end up with toxic levels to your baby. Botox is an extremely popular cosmetic procedure. It is used to help minimize lines and wrinkles. It works by injecting a neurotoxin. It's a bacteria called Clostridium botulinum. This can spread to your local system, causing an infection called botulism. Botulism can be extremely harmful to your baby. It's been linked to fetal abnormalities both in animals and humans, so it's contraindicated during pregnancy. This infection can also be a risk to the baby because it can lead to miscarriage, abortion, and premature birth, as well as a low birth weight baby. As far as breastfeeding goes, we really don't know the risks. So right now the recommendation is don't use it until you're done weaning. Please remember to hit the like and subscribe button so you can get our latest content. Varicose veins are very common during pregnancy. There are a couple ways to treat varicose veins. First, there's sclerotherapy. This is where a substance is injected into your vein, usually either a liquid or foam sealer that shuts the vein down. The second is ablation. This is heat energy from a laser fiber that's put into the vein. Both of these collapse your veins and cause it to disappear. Neither of these are recommended during pregnancy because after you give birth, many of your varicose veins will actually go away. And if you close off circulation in veins that might be needed post-pregnancy, that could cause a huge issue. It is also recommended to go ahead and not get these done until you're done breastfeeding because we really aren't clear as to the effects of these procedures while you are breastfeeding. Now, varicose veins are extremely serious because they put you at risk for a deep vein thrombosis, which is a clot inside one of these veins. So it is recommended to treat varicose veins in between your pregnancies. Facial fillers and injectables restore volume and soften lines. They are not recommended during pregnancy due to your fluctuating hormones. This is because the fillers can cause blood flow issues and swelling, and this can be exacerbated by those hormones. Basically, this is a problem for mom, not baby. Chemical peels often involve the use of chemicals that may cause harm to your baby. Additionally, local anesthetics that are commonly used during these procedures, like lidocaine, actually can cross the placenta and are not safe for your baby. Many of the chemicals used in these procedures will also pass into your breast milk, which means you shouldn't be breastfeeding during them. And finally, topical retinoid creams should be avoided while you're pregnant because they have been proven to cause congenital abnormalities. I hope this video has helped you learn all about the cosmetic procedures you may consider and whether or not you should have them when you're pregnant or breastfeeding. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.